Assalamu alaikum, and hello everyone. I'm Nero, your host for today's podcast of The Brain Talk. Welcome to yet another exciting episode where we explain various mental health and neuroscience topic in depth and from a scientific and neurological perspective. Today's topic is addiction. Addiction isn't just about repetitive behavior or substance use. It's a condition where someone feels compelled to continue, even when it's causing them harm. This issue affects millions of lives worldwide, impacting people from all walks of life. So, let's introduce our guest for today's episode, Omair Sultan, who is a fourth year medical student at Al-Faisal University. So, talk about yourself. Who are you?
Thank you, Maria, for inviting me to your podcast and allowing me to speak on such an interesting and I'd rather say underrepresented topic. Before we start, I'll briefly introduce myself in a simple sentence. When I'm not cramming for exams and I get a break, you'll find me out and about with my loved ones, traveling, occasionally reading personal development books, and finally, experimenting with content creation on Instagram.
Oh, nice. So, tell us about the topic a bit more. What is addiction?
Hmm. Define addiction. Okay. Imagine waking up every day with an unrelenting urge that pretty much consumes your thoughts, your actions, and your mind throughout your day.
Mm-hmm.
What if this thing that you're constantly craving could range all the way from just clouding your mind to also slowly destroying your mind? This is what we can call addiction, a complex chronic condition that has touched millions of people's of lives all across the globe in all walks of life.
Okay, I agree. You mentioned how addiction plays into decision making, right? So, what does that
Yeah.
actually mean? How can it affect daily life, as you mentioned?
Throughout a day, a person's mind just works on their work, their family, etc. If someone's addicted to a substance, which could be a range of stuff
Mm-hmm.
like smoking, gambling, junk food, social media, even coffee, there's so much that person can be addicted to. Their mind is constantly distracted towards that substance. And because of that distraction, which sort of clouds their mind,
Mm-hmm.
it them be unable to function properly in life, unable to focus on the real priorities in life. This is what we define as addiction.
Mm-hmm. And how do these cravings to these substances begin? Some people mention how I need this or else I can't function, such as a smoke in people's lungs. It's like a craving. How does that
Yeah.
really begin?
So cravings can be caused by various triggers that our brains have associated with past behaviors. These cues can be anything from
Mm-hmm.
specific environments, people, or even emotions that were present when the substance was being used. For someone addicted to coffee, it could simply be the
Mm-hmm.
smell of crushed beans. For someone addicted to alcohol, it could literally be the clinking of wine glasses at a bar. These triggers would then activate the same pathways in the brain that have reinforced these addictive substances.
I was thinking that coffee is very normal to be addicted to, right? People are like, I can't act normally in the morning unless I have that sip of caffeine in the day.
Yeah. And it's because most people have this misconception about addictions where, oh, it's only alcohol or oh, it's only drugs. No, it
Mm-hmm.
can rate in like various aspects of life. Like I mentioned, smoking, gambling, video games, coffee,
Mm-hmm.
etc., etc. And then there's so many misconceptions about this topic. Like some people would say, oh, it's not that hard to let go, right? Or, oh, this person just doesn't have the willpower to let go. Not really.
Mm-hmm.
When you find out that a person's entire brain chemistry can be altered just because of a substance or a simple habit, you do start to look the other way.
Mm. And from a scientific perspective, how is it so hard to let go? And why are relapses so common?
So, if I would dive into how dopamine works, should I talk about that?
Yeah. What is
All
dopamine,
right.
right?
What is dopamine? Give me a name, any random name in your mind. I'll try and form a little story out of this.
Okay, like
Any
Mary,
random name, absolutely any name. Sorry.
Mary.
Mary. Okay, let's go. Mary is a medical student. Okay, she's
Mm-hmm.
struggling with balancing her studies. She's dealing with issues at home. And she gets home from a long day at work
Mm-hmm.
and spots her brother's new PlayStation across the lounge. Usually
Mm-hmm.
she would have said no because, oh, med school, we don't have time for this. But then she thinks, no big deal. Let's just give it a try. She hasn't really
Mm-hmm.
played games before, okay? When she starts off her first level, she's making her way through the game the first time. And when she's past like this tough boss that comes at the end of a level, you get
Mm-hmm.
me?
Yeah.
Yes, she feels this intense feeling of pleasure, of
Mm-hmm.
reward. And this is where it slowly starts off because once that surge of feeling comes, with every trophy she's going to win, with every level that she's going to get past,
Mm-hmm.
more virtual coins, that rewarding feeling constantly is felt. And this is caused by a neurotransmitter in our brain called dopamine.
Mm-hmm.
And this this rush of dopamine can vary from person to person. For plenty of people, it's from smoking. For some people, it's junk food. For some people,
Mm-hmm.
it's coffee. I can't deny how good an iced Spanish latte would feel in this weather. Yeah. For others, it could be social media, from simple followers or likes. Sidetracking a little bit here. With Have you noticed how the badge on Instagram is red when you get like a like or follower?
Yeah.
Yeah, you know why it's red? These companies invest like billions of dollars in
Mm-hmm.
making sure that we're constantly using these products. We are constantly addicted to these products. And red is
Mm-hmm.
a very cool color. Out of like the entire palette that I can think of, red is strongly visible.
Mm-hmm.
Traffic lights are red. Signs that say dangerous or caution, they're red. So just like that, if the like button is red, it feels important to us. When we get those
Mm-hmm.
likes, think they're important. Again, dopamine surge, dopamine rush. And with this dopamine feeling that we get of reward and pleasure, this is how the
Mm-hmm.
brain gets addicted to what it's doing.
Uh, yeah, that's really interesting. How does it necessarily get addicted? Is it solely based off dopamine? Because I believe addiction is a medical condition, right?
Okay, a little bit more about dopamine because I want to talk about how the addiction develops, like you
Mm-hmm.
mentioned. So, Mary was addicted to online gaming, right? She enjoyed that feeling of pleasure by
Mm-hmm.
dopamine. As the brain got further exposed to video games, it caused an opposite reaction. It
Mm-hmm.
compensated by decreasing the sensitivity of the dopamine receptors. So, if Mary was playing for 1 hour a day, she suddenly won't feel the same satisfaction that she would feel before.
Mm-hmm.
Now, this dopamine surge has been lowered because, like I mentioned, the sensitivity to the receptors has been lowered. She will now move on to playing 2 hours a day, and the
Mm-hmm.
satisfaction will go back. But over time, again, the sensitivity will go down. She'll start playing with 3 hours. This is what we call developing a tolerance to video gaming,
Mm-hmm.
or to addiction, really, tolerance. Once this addiction goes into the phase where if you don't have that substance, if you're not
Mm-hmm.
engaging in that behavior, and you have withdrawal symptoms, we move on to dependence. From
Mm-hmm.
tolerance to dependence. And from the name, you can tell dependence. The person is dependent on the behavior, they are dependent
Mm-hmm.
on the drug or the substance that they're abusing. And if they're not going to use it, they will face symptoms of withdrawal, which can range across sadness, irritability, anxiety, etc.,
Mm-hmm.
etc.
That's really interesting. So it's like dopamine's constantly playing on us, and depending on how often we do it, how little we do it, it
Mm.
affects our brains.
Yes, yes. And if I should talk about the particular areas in the brain
Mm-hmm.
that it
Of course.
this would be mainly the nucleus accumbens and the ventral
Mm-hmm.
tegmental area. These are regions where the dopamine is more prevalent, and this is responsible for, again, the rush of pleasure and the rush of
Mm-hmm.
reward that we feel. In normal situations, we would get this feeling when we're working out, when we're spending time with friends, having a snack, let's say. But with the addictive behavior, the system sort of gets hijacked, if I must say,
Mm-hmm.
hijacked. And with this substance or behavior feeling almost irresistible, and again, dopamine playing in, this is
Mm-hmm.
just going to reinforce the cycle of addiction, leaving you wanting more and more and more.
Mm-hmm.
Your rational decisions making sort of just stops functioning.
Mm-hmm. And you mentioned withdrawal symptoms. Can you go more into detail about what types of withdrawal symptoms? Because I know with coffee, right? If you haven't had it for two, three
Yeah.
days, when you were so consistent, you get awful headaches, right? So what are some other
Yeah,
withdrawal
yeah.
symptoms?
So withdrawal symptoms again completely depend on what substance the
Mm-hmm.
person was using, behavior they were engaging in. Like with coffee, it's going to be headaches, irritability,
Mm-hmm.
anxiety, or something like that. With video games, it's going to be the person is not enjoying anything else. They just
Mm-hmm.
want their playing back. Lack of appetite, a lack of mood changes, like constant mood changes, etc. With, let's say, alcohol, this could be a little more severe
Mm-hmm.
because this substance that the person took, it could be nausea, it could be vomiting, and it could go on from there. GI
Mm-hmm.
issues.
Okay, so I think we've covered pretty much what is addiction, the brain's role
Yeah.
in it, and how it really takes hold. So let's go over some pathways to recovery. How can we recover from these addictions?
Okay, so overall, it's a combination of medications and therapy. Talking about medications, who the most popular medications
Mm-hmm.
with addicts would include methadone or buprenorphine. Now, these are similar to, for example, these medications are mainly used for opioid addicts. So in
Mm-hmm.
this case, we're going to talk about opioids. These two medications are opioid agonists. Agonists
Mm-hmm.
mean that they're similar to opioids, but they're not exactly the same. Emphasis again, they're similar. So why do we use them? Think of them as middlemen. They will not cause the euphoria feeling that an opioid would give, but at the same time, they will work enough to help the addict manage their cravings, help the addict
Mm-hmm.
prevent withdrawal symptoms. Because with opioid, it's such a severe drug, the withdrawal symptoms can be life-threatening in some cases. This is an example of
Mm-hmm.
medication that we use.
What are some behavioral therapies and how effective do you think they are for treating addiction?
Right. So one of the most popular therapies used for addiction include cognitive behavioral therapy, CBT. This teaches those with substance use disorders to find connections between their thoughts, their feelings, and actions, and
Mm-hmm.
increase awareness. Because when an addicted person understands why they feel a certain way or why they act a certain way
Mm-hmm.
and how those feelings and actions lead to substance use, they become better equipped to overcome these addictions. This is widely used in the world of mental health. This therapy that I'm
Mm-hmm.
talking about, cognitive behavioral therapy, it's used in overcoming anxiety. It's used in overcoming depression, panic disorders, etc. And it
Mm-hmm.
also involves being mindful, being self-aware of yourself.
Mm-hmm. And what are some innovative or interesting treatments that people take nowadays for treating addiction?
So again, the world of medicine just keeps advancing. These are just some of the new studies that I've
Mm-hmm.
read upon. There's transcranial magnetic stimulation. There's a
Mm-hmm.
deep brain stimulation. Transcranial magnetic stimulation would be a non-invasive procedure. You're
Mm-hmm.
basically going to place like magnetic fields on specific areas of the brain, like on top of the scalp. And these
Mm-hmm.
magnetic coils will then generate impulses through the brain and influence brain activity. In the same way, deep brain stimulation is a little similar in the concept, but then it's invasive. It is a
Mm-hmm.
surgical procedure where you're going to implant electrodes in the brain. Now, both of these are innovative in the way that they're not following what traditional methods have done. They're not directly affecting the behavior, they're directly affecting the brain.
Mm-hmm.
So these innovative methods might help in most cases, like in cases where traditional methods were not working. So they're useful in those
Mm-hmm.
situations in particular. But again, they're new and a lot of research needs to
Mm-hmm.
be done to make sure that science can progress properly, and we need to find out whether these are applicable to all cases or not.
So medicine's ever changing, right? So,
Yeah.
what are some of the side effects of those treatments you mentioned that people don't talk about? Because people will be taking medicines and then they go off them because they're confused on why these side effects are happening. They never had them happen to them before, and they stop taking them and lose their way to recovery.
Right. Thing is, with medicine, every medicine has side effects. And
Mm-hmm.
these could be mild, these could range to severe. In the two medications that I talked about, the opioid agonist that I mentioned,
Mm-hmm.
for example, methadone, most common side effects would range from lightheadedness, dizziness, sedation, nausea, vomiting. But has one very common adverse effect. This is
Mm-hmm.
respiratory depression. And this could, to a lesser extent, lead to hypertension, lead to shock, cardiac arrest, etc. That is why overall medications don't address
Mm-hmm.
all aspects of addiction. So they're usually combined with counseling and therapy for the best results, and in the future, maybe pave the way for personalized
Mm-hmm.
medicine.
And how do you think personalized medicine might change addiction treatment and how we view it in the far future?
So currently, it does feel like the future of addiction treatment may indeed lie in personalized medicine,
Mm-hmm.
where each person's individual brain chemistry is considered, each person's individual genetics are considered. This could overall then increase the effectiveness of the treatments that are
Mm-hmm.
being used. Because look, we understand the individual now, we understand their brain chemistry, and because of that, it would reduce the sort of trial and error approach that we
Mm-hmm.
currently have. With personalized medicine, this would be lower. Again, it's all very new. The brain is still such a complex structure, and understanding individual variations between each person, it's going to require a lot of research. It's still a while
Mm-hmm.
away. Even when it's developed, making it accessible could prove to be a problem, because usually these advanced treatments are a lot more
Oh
expensive.
yeah.
But
Mm-hmm.
over time, lowering costs, making sure it's distributed across the country, etc., making it accessible to everyone.
Mm-hmm. And looking towards the future, what are some ethical considerations that we should keep in mind when we create these new and different treatments?
Hmm. Ethical consideration medicine again vital to ensure patients
Mm-hmm.
are treated with respect, they're treated with honesty and care. As new treatments are developed for addiction,
Mm-hmm.
we must continue to ensure number one, our patients' privacy and confidentiality. Protecting each individual's sensitive
Mm-hmm.
information and implementing strict data protection measures is a must. We need to make sure that this data stays within the hospital. And who has access to it? Only the doctors that need the data. You understand? You get me?
Mm-hmm. Yeah.
Yeah. And of course, these treatments must be within reach of all individuals, regardless of socioeconomic status, geographical location, or other
Mm-hmm.
barriers.
Of course, I think that also involves, I believe, HIPAA. I'm not sure exactly what it stands for, but it's basically doctor patient confidentiality, or other people can't know their affairs, and doctors
Yeah.
usually don't get to speak freely on what's
Yes.
happening between the patient. But I believe there's a lot of downsides to this, especially with the doctor, because they can't speak on it. Like, imagine if there was some sort of outbreak between the patient and the doctor, and they want to take it to the
Mhm.
courts. But the doctor can't speak about what happened between the two because it's confidential. So, for future retrospect, especially with addiction, how can we talk about that more freely without going against confidentiality and privacy laws?
So we have asked kind of moves into category of law, but what
Mm-hmm.
I know is about, again, ethical oversight. If we
Mm-hmm.
have enough review boards that oversee and supervise research being conducted, if we
Mm-hmm.
have enough review boards that see patients being satisfied with their healthcare, because if they're satisfied, they're not going to go to courts, like
Mm-hmm.
you mentioned, while still being transparent enough about it so that the
Mm-hmm.
individual knows their rights. They know their rights. And if their data is being used somewhere, they're aware of it. Again, consent.
Mm-hmm.
Everywhere, consent is
Exactly.
crucial. And if we get consent from patients, this shouldn't be a problem overall.
Mm-hmm.
Balancing innovations, ethical considerations with caution is a must because, again, we don't want to open a can of worms.
So, throughout our podcast, we discussed various topics on dealing with addiction. What is addiction and recovery, including future references on how we can make our treatments more personalized. So, what are
Mm.
your takeaways from today?
Winding today's episode up, addiction is not something people choose to have. It's not
Mm-hmm.
something people can easily give up. It's much more than a battle of simple willpower. If you're struggling with an addiction, speak up. There is no shame in seeking help. There
Hmm.
are plenty of in-person community groups, mental health professionals, and thousands of resources online at the tips of your fingers, especially with how accessible
Mm-hmm.
technology and social media is. Whether it's you who's struggling, whether you're supporting someone else, know that compassion and understanding are the keys to breaking the chains of addiction. Whether you see it right now or not, there is always a light at the end of the tunnel. So let's move forward together one step at a time.
Thank you, everyone, for joining us today. That concludes our discussion on addiction. If you or someone you know needs support, you can reach out to 920-033360 for psychological counseling in Saudi Arabia. I hope you found this episode beneficial and learned something new. See you in our next episode of The Brain Talk.